As insights increasingly emerge from research on genetics, this research carries implications for other aspects of medicine. Choi and colleagues use some of these new insights to ask questions about the nature of relationships between risk factors and expressions of major depressive disorder. The authors use a technique that is called Mendelian randomization. And this technique allows scientists to sort through panels of risk factors to differentiate those that are particularly important because they might be causally related to the outcome. In this new research, the important insights are to separate some of the risk factors for major depressive disorder that appear to be causally related to the condition. So, for example, findings emerge to suggest that social isolation might be one of these risk factors. Such findings should encourage clinicians to work with their patients to increase their exposure to social settings with the hope that this might actually change the risk for major depressive disorder. Many years of research relate profiles in hormones to risk for various mental disorders. And one of the particularly strong areas of research finds a link between low testosterone and the risk for major depressive disorder. In an important new randomized controlled trial, Dichtel and colleagues examined the degree to which testosterone administration might actually be useful in the treatment of major depression. And the important findings to come out of this new randomized controlled trial are to suggest that testosterone may in fact not be helpful in the treatment of depression. And this demonstrates why it's important to move beyond observational studies to experiments that examine the efficacy of a treatment. For clinicians, this should raise a certain level of caution about using a treatment like testosterone therapy in the hopes of reducing depressive symptoms.